Okay, so this is a tutorial on the humerus. We'll discuss the anatomy of the humerus. Let me isolate it. We'll discuss the anatomy of the humerus in the three compartments, in the three ends. First, we'll discuss the proximal end of the humerus, then the shaft or the body of the humerus, and then the distal end of the humerus. So, first thing first, we'll discuss the humerus. So this is the humerus, or this is the head of the humerus, you can say, which articulates with the glenoid fossa of the scapula, forming the glenohumeral joint or the shoulder joint. Then we have the anatomical neck. This is the anatomical neck, which can be seen quite easily all along. This is the anatomical neck, right? And then we have the greater tubercle or greater tuberosity of the humerus, which lies on the lateral aspect. And then we have the lesser tuberosity or the lesser tubercle, and between the greater tuberosity and the lesser tuberosity we have the intertubercular groove. You can see that groove easily, the intertubercular groove or intertubercular sulcus, or it is also called the bicipital groove, right? Then we have the anatomical neck. This is the anatomical neck. This is anatomical neck, and it is a common site for the fracture. This is anatomical neck. Now we will discuss the shaft of the humerus, right? So this is the shaft. Let me show it. It was like that, yeah, right. So this is the radial, this is the deltoid tuberosity, which is a point of insertion for the deltoid muscle. And then on the posterior aspect we have this groove is called radial groove, which is it is also called a spiral groove, which is the site for the, which is the track or which is the path for the radial nerve along with the profunda brachia artery. So this is all about the shaft of the body. Then we have distal end. We have a pulley shaped structure called trochlea. This is the trochlea. You can see that white pin, it's called a trochlea. And then we have the head shaped, or this is the capitulum, right? This is the capitulum, and above the capitulum we have the radial fossa, and above the trochlea we have the coronoid fossa. And we have on the medial aspect the medial epicondyle, which is a bit larger than the lateral epicondyle. Then this is the lateral epicondyle of the humerus. Above the medial epicondyle we have the medial supracondylar ridge, and above the lateral epicondyle we have the lateral supracondylar ridge. And on the posterior aspect we have the olecranon fossa. This is this is a point of attachment with the olecranon process of the ulna. So this is all about the humerus. Thank you.